All right, welcome back to the brain injury discussion, everybody. This is Jay. I hope everyone's doing well, and we are going to be talking about something that is actually very serious. We're going to be talking about opioids and brain injury. Now, you might have heard opioids being mentioned quite a lot in the news over the last few years. And it is because, yes, there is an epidemic of opioid overdoses. And we're going to get into how you can get a brain injury from that, and also maybe how not to get a brain injury from that. So, with that being said, we got a lot of slides to cover. I also invite you to give us a thumbs up, maybe subscribe, maybe share this video with a friend, and maybe you get something out of it. We'd love to hear it in the comment section. So let's get into it. So first off, what are opioids? Well, opioids are usually pain management medications. You'll hear some examples later on, and they can be either taken illicitly or illegally, or they can be prescribed by a medical doctor and taken legally. Usually it is prescribed for pain, which is a sensation that actually goes into the brain. Now, this graphic is kind of, uh, where the pain sensors are in the body. They're in the brain. And so what this does is it helps alleviate that pain. So in 2020, again, source is down here. If you want to look this up, there is 88,295 deaths from illicit drugs. 80% were opioid related. So if you do the math, that is well over 60,000 deaths just from opioids. And that is very, very serious. Again, non-fatal overdoses can lead to brain damage, and we'll talk about how that would happen. And so overdoses have in fact increased over the last 20 years. And you might be asking, well, Jay, um, this is a problem that's increasing? Yes, it's been increasing over the last 20 or so years. And again, this was out of an article published in 2021. So as of the making of this video, this article is only 4 years old. And who knows where it really is today. So but this has become a problem that's really come to the forefront. And we'll get a little bit into how this became kind of an issue. So obviously, I mentioned pain management in the previous slide. It was used for pain treatment, but they looked at pain differently than we do today. They thought it was just normal. But pain treatment, this was commonly used, and you hear about like the American Civil War. They would give opium to wounded soldiers. They would give opium to wounded soldiers in other wars, and there was no regulation on it, not until 1914, and that is the Harrison Narcotics Act of 1914, where it finally required people to register in order to prescribe opium or prescribe an opiate drug. And so it was dangerous back then, but it was not very common for a very long time. It was kind of used as a last ditch cheap resort, especially during times of warfare. And in the 1990s, it skyrocketed because they started calling pain the fifth vital sign. We're going to get into why that is, but opioids and pain management have been a combination for a while. And obviously, that started to change because opioids are like the last resort to pain management at this time. So, that being said, that's a little bit of the background of how we got to using opioids. And so, what are these opioids you're talking about? Well, this is a very common list here, but let's look. Morphine. How many movies and TV shows have you heard someone call out, I need morphine for the pain? Morphine is an opioid medication. You might also hear codeine being prescribed. Oxymorphone, hydromorphone, those are opioids as well. Oxycodone, hydrocodones, those are still prescribed. Those are opioids too. I'm not going to pronounce this next word, but you kind of get the drift where it's like fentanyl. That's been in the news very recently as well. And it is kind of in the same family. Um, and it's kind of connected to opioids. It's synthetic. And same thing goes with methadone. So you start seeing this, and again, if you want to look, here's my source. Feel free to look. Um, you start seeing these pain medications be really widespread, especially in areas where there's a lot of manual labor to be done, and especially in areas where lower back pain is probably very common. So, these are all very strong medications to deal with pain. And of course, now there's a lot more alternatives out there. But think about it. This really wasn't a huge deal until the 1990s, even though it had been around at least 150 years prior to that. So, that being said, let's talk about how you get a brain injury from this. Now, obviously, your brain requires something called oxygen. You breathe it in. That is what is allowing me to speak to you right now. And what opioids do is they cause respiratory depression or respiratory suppression. And as we can see in this graphic here, thank goodness he fell on his stomach. But what the opioids really do is they slow that respiratory drive. And not only, can cause you to pass out and become unconscious, but it can also slow your respiratory drive and cause you to go into a state of cerebral hypoxia. Cerebral hypoxia. So we break that word down, hypoxia, not enough oxygen. And again, that is the cause of a brain injury from opioid overdoses. And so when someone looks at that and think, okay, the lowering of the breathing is not just that the medication itself is just the problem. No, it's what it does to the rest of the body. It slows the breathing, it slows the oxygen intake, it slows the heart rate as well. And what happens is that that blood is not becoming quite as oxygenated. There's not enough oxygen being carried to the brain to create what's called perfusion, which is a fancy term that means making sure there's enough oxygen. But that cerebral hypoxia is what causes the brain injury. So, and the consequences of that neurocognitive impairment that can happen. Um, but the side effects range. They can be very mild. Sometimes you might not even notice them, or they could go to severe. And this could be cognitive, it could be neurological. Again, a myriad of different ways that you could show an injury from this, but usually from opioids, it is because the respiratory problems that slows the respiratory drive, that slows the breathing drive, and it also deoxygenates the head, which is not a good thing. So, that being said, this is why it's kind of serious. This is why we got a lot of opioid overdose brain injuries. So, with that being said, let's move on. Let's figure out what else is in here. So, what happens with opioids and those that maybe survived that car accident or maybe survived that workplace accident or got that traumatic brain injury? Well, we know that usually pain is very poorly managed when it comes to traumatic brain injury survivors. Pain um, needs to be addressed and usually is addressed poorly. So, again, traumatic brain injury victims or survivors are at a higher risk of overdosing. That could be from a number of different reasons. That could be maybe a loss of sleep, maybe they're taking them, but then they forgot to take it, or maybe they didn't forget to take it. Maybe it's a memory thing. Maybe they can't remember the last time they took one of those medications, especially an opioid. Maybe they forgot they did take it 2 hours ago, and then they think they're taking the right dose, but then obviously all of these things can go into effect. And opioids are very addictive, and this can cause lifelong deficits that may persist again from a brain injury. And also, this is one of the medications that might cause what's called a dependence. Dependence is one of those unfortunate things where if you're on a drug so long, your body might eventually require it in order to function. And we don't want people to become dependent on pain medications. We want people to be off of these things because they indeed can, in fact, be dangerous. And so, what are the recent updates? Well, in 2016, mind you, and again, if you want to cite me, um, there's a source. It's down at the bottom of the screen. It'll be in the comment section below. The American Medical Association, or the AMA, is supposed to stop considering pain a vital sign. I've never thought it was really a vital sign in the first place, but you know, it's not, it should not be considered along the lines of a blood pressure or pulse or heart rate or oxygenation status or respiration count. This needs to be considered as separate. So the AMA, American Medical Association, is to reevaluate pain management techniques. Maybe they're going to look at a lot of new alternatives instead of just going for what is the most powerful thing. And then maybe they would prescribe an alternate, maybe something that is alternate to the opioids. So again, this is widely available too. Um, Anti-inflammatories are out there. You have a ton of different alternatives for opioids out there. And one of the biggest things is Narcan or naloxone. That is something that they trained us in my last CPR class was how to use Narcan, which in this case it was a nasal spray. It was just one nasal spray up, and this is to reverse an opioid overdose. And we're going to get into how that works because I find it fascinating. But then again, I'm a brain guy. I find it a lot of things fascinating. So how does Narcan actually work? Or naloxone? It reverses the overdoses. So, in your brain, you have receptors that will intake the Narcan, as in this image to the right here, where it will be an antagonist. So, it kicks the opioid off. So, it antagonizes the opioid off of the receptor. And so, this is also FDA. There's multiple ways you can give this. And there's even, like I said, a nasal spray version. No IVs, nothing crazy. You just spray it in their nose. Um, it also creates a prompt and quick response, and also a response that can get you to that next level of care. And now, again, if you are if you have used a Narcan, chances are that person can go back into overdose. So that's why it's a good idea to call 911 when you have to use Narcan. One, that way the professional EMTs get there. They can make sure that, it was either enough Narcan or maybe there isn't enough Narcan. So that being said, I still recommend CPR classes for everybody. Might be good to learn how to use Narcan too. It's very easy. So when you consider all this, we see that in the opioid overdose, we see that these opioids, they fit into the receptors. Narcan displaces them, thus pulling these receptors out. The opioids are now being pulled out of that. So great. That's how the overdoses are reversed, albeit sometimes it can be temporary. So, what does this leave me as a brain injury case manager to conclude? Well, if someone has a history of a traumatic brain injury or traumatic brain injury survivor, they're at higher risk with opioids. So again, that's a cautionary thing right there. It's a layer of extra caution I'm thinking about. Hypoxia via the opioid overdose is unfortunately common, but there is Narcan. There are life-saving things out there for people. And, bystanders can do something about it. New treatments for pain are being explored. So you don't have to take a morphine, a codeine, a hydrocodone, a oxycontin to relieve the pain. No, there are other options out there that can be utilized. And of course, this wonderful thing here, Narcan nasal spray. Isn't that wonderful? We get to actually reverse it. And yes, you don't actually have to start an IV or anything. So, but that's a lot to unpack there. But just remember, this is all good stuff. By the way, sources there, description below, like, comment, and subscribe. Have a wonderful day, everybody.